May is Mental Health Awareness Month. Because of the importance of this month and the importance of mental health in general, I kind of wanted to make more videos about mental health based on the number of subscribers I've gotten and the comments on the past videos of mental health that I've done in the past. I think it's more of what I want to focus on this channel. So I think for this video, I'm just going to go back to the comment section of the two videos that I've posted in the past on my channel and answer them to the best of my ability. Okay, so first question, what's the pay? Why so little nurses in this spot? Asked by Eric EE. So the pay is just like any other nursing, is going to differ based on the state that you're in. I will say that California pays, I think this is the same in all specialties, pays the highest. For example, currently, when I started my job, I started at, I believe, $38 an hour. If I had stayed in Iowa, for example, I would have started at $24 an hour. Why so little nurses in this spot? In general, there is a nursing shortage. Even though there's so many people going to nursing school and graduating, getting their BSN, a lot of the people today are not staying at the bedside. They're going on to get their master's, they're going on to get their DNP, which is not a bad thing, but we just need more people at the bedside. And that's what they mean by the nursing shortage. Why so little nurses in this spot in psych in general? I think that just shows with the stigma. Not many people know about mental health, not people know how to deal with it, not many people know how to address it. That comes the same in the healthcare field. Not many people know how to be a psych nurse, not many people know what that means or what it's like. I think that if you were to ask, hey, what's it like to be an ICU nurse? What's it like to be an ER nurse? What's it like to be a mother baby nurse? It'd be much easier to answer than what is it like to be a psych nurse. For example, when I go to, like, say CVS. Last time I went to CVS, the cashier asked, hey, what do you do for work? And I said I was a psych nurse. And they're like, oh, so you hang out with all the crazy people all day. They don't even take in mind that, yes, there are paranoid, crazy people, crazy patients out there, but most of the time I'm hanging out with people that are depressed, people that are anxious, people that have eating disorders, and so on. Next question, it basically says, do you ever need to give needles, or is there someone else to do that? It differs also across psych facilities that you work at. For example, when I was in my preceptorship in college, I worked on a medical psychiatric unit, which I believe there's only 5 or 6 in the nation that do that, so it's very slim to none that you'll ever be giving an IV or drawing blood. I do miss that about psych. I miss the kind of med-surg area, which is why I do want to go back into med psych. But currently on the unit that I work on, lab comes and draws blood. We never do IVs. Long story short to that question, no, we do not use needles. Unless, of course, you're giving an IM injection to a patient. Next question, where do you work? I am also a psych nurse, by Linda Holder. I currently work in Southern California in San Diego in one of the psych hospitals. Jane commented, I'm a tele-nurse thinking about going into psych, and this video was great. Why did you decide to go into psych? I guess the reason why I did go into psych though is because there's such a disparity. It's been 2 years since I made my first video about mental health nursing, February 28th, 2016. And in this video, I kind of say like why I chose to be a psych nurse. I think my main reason of being a psych nurse is because it's needed. And that's mostly it. At what point in your training are you actually trained to work with mental health issues? Is there some sort of special training, or do you learn on the floor? This question's a bit hard. I feel like, at what point do you learn to be an ICU nurse? So, short answer is you learn by experience. Is special training, however, through the accreditation of nursing, you can get board certified in the field of psychiatric mental health. Just as you can get board certified for any other specialty of nursing, you need to have worked 2 years full-time as a psych nurse on an inpatient unit, have X number of continuing education hours, and pass an exam just like the NCLEX. For me, myself, I learned a lot on the floor. Obviously, in my psych rotation and psych class in nursing school, I learned the basics of diagnoses and medication, but actually working one-to-one with patients with actual diagnoses and actually taking the medication is where I learned the most about how to work with mental health issues. So those are the questions mostly that I got on the past videos. A lot of people have been just saying like, make more videos, like we need more of this, but I don't really know what you want. So just comment down below asking any question anytime this month. I'm gonna be looking at my comments and seeing what questions I can answer to help break down the stigma that we've been trying to fight for so long. I want to give as much information as I can to anybody that's wondering. Any questions about like what's the difference with bipolar 1, bipolar 2, schizoaffective or schizophrenia. If you're a nursing student that's about to graduate nursing school and you're looking into the psychiatric field, ask any questions based on that. I just need a little more specific questions, and I can go off of there. I really want to just help people out this month because it's so important. But yeah, that's it. I hope to see comments and questions so I can help people out. Bye.